This bill recognizes that health equity, it allows people to have the full access, have opportunity to have full access to the best health care that they need. And it provides a roadmap and a step in the direction that allows that by giving medical schools at the University of Washington, Washington State University, the opportunity to build an educational, to build into their education of healthcare professionals and physicians, a cultural competency and an understanding that social determinants of health, that historic injustices, that societal differences can be just as important to achieving this full health care as other tools and skills and abilities that we teach our students. We know that from the research that there are 11 deaths per 1,000 live births among Black Americans, almost twice the national average. These are, we also know that Black Americans are 3.57 times more likely to die from COVID, and the Latinx population nearly 2 times more likely to die from COVID than the white population. We know that 43% that of Latinx population, 43% have COVID positivity when there's only 13% in our Washington State population. Some of these disparities and these differences are due to economic factors, to environmental factors, to housing, to education, employment, and they reflect disparities like race, language barriers, and geography, but they also reflect historic injustices and injustices that we need to have a better understanding of as healthcare professionals and for doctors in our society. The schools of medicine in this bill are tasked with the formative role of educating. Well, we know they're tasked with the formative role of educating medical healthcare professionals. And in order to care effectively for people of diverse cultures and groups and communities, we need to better understand those disparities and help our medical students and our medical professionals have the tools that they need to be able to deliver the best healthcare possible for everyone. And this includes counteracting racism and implicit bias in healthcare. So this bill was developed with a strong and diverse coalition of medical professionals, medical students, education leaders who champion this bill, with task forces that work through the data. And I'm confident that with this legislation, we can build a foundation for more equitable health outcomes that starts with the quality of education medical students receive. And I urge your support. Thank you.